My name is Meg Smith. I'm co-owner of Cloud9 Birth Services in Naperville, Illinois. I'm a certified birth doula through Donut International. I'm a pro doula, postpartum and infant care specialist, and a certified childbirth educator. We are going to learn about the peanut balls today. These are from Premier Birth Tools. They're hospital grade, burst resistant, and latex free. There's 4 different sizes. This is a 40 centimeter ball. This is used for people who are 5'3" and shorter. This is a 50 centimeter ball used for people who are between 5'3" and 5'7". And this is a 60 centimeter ball used for people who are 5'7" and taller. The 70 centimeter ball is used only on the floor in a straddling position. The peanut balls are very easy to take care of. If you're on the labor and delivery floor, you can wipe them down with a sandy wipe, or you can simply use a warm washcloth with soap and water. Don't store the peanut balls by a window, vent, or a hot surface as they can deflate or pop. Store them off the ground and cover with a hospital gown or a sheet when you're using them with your clients. The only reason that you cannot use a peanut ball with clients or a patient is if they have hip or back injuries or a history of hip, back, or pelvic surgeries or DVT. The peanut ball is wonderful because you can use it for medicated or unmedicated births. You can use it for hospital births or home births. Just make sure that you're switching positions every 30 to 45 minutes to encourage proper rotation and descent of the baby. The peanut ball has been shown to speed 8 out of 10 labors and reduce the cesarean rate. Research from Premier Birth Tools shows that the peanut ball can shorten the first stage of labor by 90 minutes and the second stage, or the pushing stage, by 22 minutes. And research has shown that they can reduce the cesarean rate by 12%. In the 350 births I've attended, I can tell you that my clients appreciate a labor that is shorter and more efficient. So let's see how we can make that happen. Okay, the first position that we're going to demonstrate is for a baby that is in the inlet of the pelvis. So at a -3 or a -2 station, you gotta make sure that you pick the correct size ball for the patient or the client that you're working with. My partner Terry is 5'2", so we are gonna utilize the 40 centimeter ball. The way that you make sure that it's correct is the ankle should not be hanging, but is well stabilized. So Terry, if you would just lift up your leg. Okay. This is sometimes a position that I think is just typically used with the peanut balls, just sideline. But what we're gonna do is we're gonna go into a flying cowgirl position to open up the inlet of the pelvis so that the baby can descend and really engage into the pelvis. So as you can see, Terry's legs are straight here, but what we're gonna do is really bring them back so that the inlet of the pelvis is more open. You do this for as long as the client or patient can be comfortable with it. You don't want there to be any strain on her back. But typically every 30 to 45 minutes, we're gonna switch positions. The next position that we are gonna demonstrate is called sitting on the peanut ball with knees out. It's important in these positions when the baby's in the inlet to have the mother's knees pointed out in all of the different positions. So Tara, if you would just sit on the ball. Again, this is the 70 centimeter ball, only used for positions on the floor. What's nice about this is the partner can be doing counter pressure or even releasing the psoas muscles as the partner is back here when the client's having contractions. You can notice that Terry's knees are pointed out, again, for external rotation. The third position that we are going to demonstrate for an inlet of the pelvis station, or a baby that's at a -3 or -2 station, is called the semi-sitting lunge. Again, we're going to utilize the 40 centimeter ball with Terry. So Terry, if you could just lift up one leg, and we're just going to put the ball right there. Sometimes it's hard for the clients to have one leg straight, so you can bend it like that. And it just helps, again, it's a comfortable seated position that you can utilize with a client with or without an epidural. The next set of positions that we're going to demonstrate are for when the baby is in the mid-pelvis, which is a -1 or a 0 station. It's important to make sure that your client or patient's knees are parallel. The first position that we're going to show, again, with the 40 centimeter ball, because Terry is 5'2", we are going to have her lift up her knees. The ball is going to go straight here, yep, just like that. Knees are parallel and bent, and just rest like that. You can see that she's got her arm under her head to hold herself up. The next position we're going to show is sitting on the 70 centimeter ball, knees forward. This position is used when the baby is in the mid-pelvis that is -1 or a 0 station. Notice Terry's knees are pointed forward In the previous video, where we demonstrated sitting on the ball, Terry's knees were pointed out for a baby slightly higher in the inlet of the pelvis. Again, for this position, Terry's knees and feet are forward for a baby in the mid-pelvis. Okay. The next position that we are going to show is the tuck position holding the ball. These three positions that we have been showing are for when the baby is in the mid-pelvis and we want the baby to descend and rotate. This assists with rotation of an asymmetrical position of the baby and aids in descent. Straddling the ball with a partner, as we showed with the yellow one, the partner can do counter pressure. As Terry is going to be hugging the ball, you can see how her pelvis actually opens up. So we're using the 40-centimeter ball, putting it right in between her knees. Now I'm going to push it up and she's going to hug it. See how much more open her pelvis is here. That's what we're looking for the baby to descend and rotate. The next position that we're going to show is for a baby that's in a +2 or a lower station, which is the outlet of the pelvis. We're going to show knees together, heels out. And actually, Gail Tully of Spinning Babies had coined the term. So Terry, if you could just lift up your knees. Thank you. We're going to put the 40-centimeter ball right in between her heels. Again, knees together, heels out. We're also going to use a rebozo for the comfort in between Terry's knees. This will help a baby in the outlet of the pelvis to descend and rotate. The next position that we are going to demonstrate is, again, Terry sitting on the 70-centimeter ball. Her knees are together and her heels are out. If you can notice that right now her feet are pointed straight, and as she turns her feet in, just like that, knees together, heels out. That's, again, going to help the baby to descend and rotate through the outlet of the pelvis. The last position that we're going to show are Terry's on her hands and knees, and she's going to be leaning over the 60-centimeter ball. Again, this is for the outlet of the pelvis. We're going to want to make sure that knees are together, heels are out. She's leaning into the ball. This is going to give some room for the baby to, again, descend and rotate. She can let her belly hang. She might be feeling a little bit of pressure at this time, so this position might be feeling really good. Again, knees together, heels out. Now that we have demonstrated how to use the peanut balls in different positions, talked about the care and cleaning, talked about when not to use the peanut ball, and cited the research that the peanut balls do shorten labor and they do shorten the risk of cesarean deliveries, let's talk about where you can get all of this merchandise. PremierBirthTools.com, you can get all sizes of the peanut ball. They have very nice, brightly colored, illustrated picture cards that you can easily reference. They're laminated. I just keep them in my doula bag, pull them out when I need some different ideas of how to get the baby to descend and rotate. Rebozo bag. Sherry Grant just wrote this great peanut ball book. It's very easy to read, as you can tell. Mine is well loved. I've read it a few times and referenced it. It's got pictures in it. Again, very easy to read. So just visit PremierBirthTools.com for all of your peanut ball needs. Thanks very much.